I understand that this is what you get, and you're trying to tell me that instead of this, I could have this. With your machines and your calibration, you can accomplish for most people with one of these.
That's correct.
Okay. Tell me about the device. How does it work? What does it do?
Okay. Well, there's a whole variety of devices, and this is just one example. But
why are there so many?
Well, because every person is different, and every person may not have the same issues with their airway. And so there's different appliances that address different issues of the airway.
And what about, like I noticed some of them you can open and some of them you can't. And
right. Well, they're custom made to each person, and this particular one...
This looks like it's fitted right on the teeth. I don't even hardly see the clear part.
Right. It is fitted on the teeth, custom to fit the patient.
Okay.
And it basically, it gently repositions the jaw forward.
Okay.
And we want to be able to do this very carefully so that we don't affect the TMJ.
Now I watch, everybody else, I watch TV. Part of the reason I do what I do, I want to educate the public, is all this stuff's out there. I see nose bands that hold your nose open, a pillow that makes you sleep right, or a mattress, or a tea, or whatever, or this thing that you buy and you bite it, and it supposedly cures your sleep apnea, or whatever. Is that the same?
No, it's not, because that's a one-size-fits-all type of appliance, and every patient's different. And some patients, just simply by putting something else in their mouth that opens up their bite, sometimes that can actually make their airway worse. It can close it up even more. And
really?
Sometimes, yes, and sometimes that's not the issue. Sometimes we want to reposition the jaw forward, but not cause a lot of changes in the vertical dimension, and sometimes it's the opposite.
Well, I deal with doctors and dentists all over the world. They tell me that moving the jaw too far forward or too far back can cause tremendous... The federal government says that the majority of migraines, the one thing they're able to trace them all back to, or some of, is dental work, having a tooth pulled. Or,
yes.
But if they reposition this wrong, it can cause
a lot of problems
for the rest of your life.
Right.
So if you just buy something, and how do you know where to put your lower jaw if you're biting, if the whole idea is to pull the jaw? I mean,
that's the whole problem. There's no way to assess that at home. That's why what we do in the office, it's important to do this with a qualified practitioner who's been trained, because what we do here is we use our technology, our equipment, to monitor how our appliances are doing. So before we fabricate the appliance, using our pharyngometer, our rhinometer, and various other methods, we figure out which type of appliance would be best for you. Then we test it out when we deliver it.
Do you think the fact that you're a woman allows you to be a little bit more sensitive to people's needs?
I think in my practice, yes. As far as the patients that you referred to, we were able to help them feel comfortable to open up as to what's really going on with them, and they were able to answer the questions accurately so that we can address their problem.
What percentage of the population, I mean, it's my understanding that anybody that goes to get a sleep study, is going to get prescribed one of these, this sexy piece of material. What percentage of the population can actually benefit from this? Is it 20% of people that snore with sleep apnea, 30?
90%.
About 90%. The only ones that can help, if I understand you right, is what's considered severe apneics, which is about 10%.
Right.
And for those, the hose is going to blow. But other than that, you can put this in the closet. Simple to carry, simple to use.
But even so, even with for the 10% that are severe, we can work together. I work together with the physicians to do some co-therapy.
Really?
If they're severe. So with this appliance, we can lower the CPAP level, the pressure of the air going down their throat.
Well, we certainly learned a lot today from Dr. Luckman about dentistry, snoring, and sleep apnea, and what seems to be the simplest and easiest way to treat it. So now we're going to meet the other half of the practice, Dr. Mark Bowers. Dr. Bowers,
hi.
Thanks again for letting my crew and I come out today and spend some time with us, and you're going to educate me on dental implants, full mouth reconstruction. Having your wife, and I have to ask because I ask her, but having your wife as your partner and having her practice a different type of dentistry than you do, does that help you? Does it hinder you? I mean, my wife would probably kill me if we worked together every day. Tell me a little bit about how that works for you.
It works out well because we really don't do exactly the same aspects of practicing dentistry.
But you do, you both seem to have a passion or a commitment. I talked to Dr. Luckman, everything was about technology and training.
Yes.
I speak to you, well, you say that like that's just the norm. I said that to you on the phone. What about training? And you spend hundreds and thousands of hours in training. And, you know, I interview dentists all over the country, and that's not the norm. Normally people learn what they're doing, and then, as I spoke to you about, there's dentists out there right now practicing dentistry that's 100 years old.
Right.
Why?
Basically because they only take enough continuing education that the state requires them to take, which is 70 hours every 2 years, and we take as much as we can so that we can stay current on everything. Now
you talk to me about, because I have everybody I talk to, all these dentists, and they all say, oh, experience, experience, experience. And when I said that to you, you said, yeah, experience is important, but it's not as important as education and training. And you made the point to me that unfortunately, people that just rely on experience, a lot of times what happens is they've never dealt with a problem or an issue, and they don't know what to do when it happens. And for a patient like me, unfortunately, the only time you find that out is after something's been done. You said you belong to not only continuing education, but you belong to study clubs where you guys share
information on things that we do well, things that succeed, things that don't succeed, and what to do when it doesn't succeed. And so you're not just drawing on your own little limited information that you have. Experience is good, but it's just your experience. And so the thing that's good about education is you get to go benefit from people who do a lot of these procedures like you do, and you get to share with them in study clubs about their successes and the failures. And so if things go wrong, I know what to do when they go wrong. It's great to have 100 cases that go right and none ever goes wrong, but when the one goes wrong and you don't know what to do, then you're stuck, and that's a big problem.
And then the one that pays the most, obviously, is the patient. You and I were
Yes.
talking, you asked me not to bring this up, but I don't always listen. We talked about you fixing things that have been done at other offices that maybe were, do you think that motivates you? The fact that you see people come in that spend their hard-earned money, they've gone to somebody, they put their trust in them, thinking they were getting, we put our trust in the medical professionals. Right. I do what I do because I found out over time, not everybody deserves your trust. Does that motivate you, the fact that you see people that have gone out and had work done that didn't turn out right, or hurt them or affected their life negatively?
Well, actually, that's why I started placing my own implants, is because I saw people came from different specialists that the implants weren't placed in the right angle, the right direction, and the right spot, and so you're having to put a tooth in the middle of two implants, and that doesn't look right aesthetically, but you're the person that the patient holds accountable.
Right, because you do the final.
You've got to make it turn out right. You're the one that's got to give them teeth. So I got tired of trying to correct things like that, and I thought as long as I want to be responsible for the final outcome, I'm going to be the person who's going to determine where that goes.
So do you think the fact that you now are ultimately responsible for the placement of the implant, obviously you can put it where it's going to be best for restorative, and the restoration, and the fact that it's all done in one office, especially today with gas being what it is and driving around and time, do you think that's really a big benefit?
Well, the patients love that, one, because they're already used to me, and they've known me for varying amounts of time, but they're used to me, and they don't have to get to know anybody else. They don't have to accept anybody else's fee and see if anybody else takes their insurance, and all those different factors.
So you just make it simple for them?
Yeah.
All right, come on, show me around.
All right. Herman needed a set of partial dentures, and he had periodontal disease, and so we cleaned up his periodontal disease and gave him an upper and a lower partial denture. And then he went away from the practice for a little while, and then he came back, and his periodontal disease has gotten worse, and so his teeth were moving around, and they wouldn't support his partial dentures anymore. And so I suggested to him that we could take out the rest of his teeth, give him full dentures that were supported on implants, and they'd be rock solid.
They feel exactly like my own teeth. And I find it hard to believe that any other dentist could have did a better job than he did. I would recommend him to anybody, my family,